Okay, we have reached the top of the hour, so let's go ahead and begin. Good afternoon, everyone, and thank you for joining us today. My name is Dr. Scott Smith. I'm a member of the technical consulting team at Elanco Animal Health, and it's my pleasure today to introduce our presenter, Dr. Sandra Godden. Sandra is a 1993 graduate of the Ontario Veterinary College at the University of Guelph. After working for 2 years as an associate veterinarian in a mixed practice in Eastern Ontario, she returned to Guelph to sorry, I had a technical difficulty again. Anyway, she got her DVSC specializing in dairy production medicine. From 1998 to the present, she has been a member of the Department of Veterinary Population Medicine at the University of Minnesota, where she is involved with professional student teaching, applied research, and outreach activities in dairy production medicine. Sandra is a past president of the National Mastitis Council. Her major academic interests currently include applied research in mastitis control, colostrum and calf health management. And on a personal note, I had the opportunity to work with Sandra in the past when I was in practice. I worked on her with a project when she was first beginning to look at the impact of heat treating colostrum on colostral characteristics. So thank you, Sandra, for presenting today, and the floor is yours.
Thank you, Scott. And thank you to Dairy Calf and Heifer Association and Elanco for organizing this. So yeah, we're going to spend the next, 45 minutes or so talking about colostrum management. Some of this will be just a review of the oldies but goodies, the important stuff that everybody needs to remember to do. But as much as possible, we're going to bring in anything new or interesting or different that can help producers out there to see if there are opportunities to tweak their program. So, assuming I can get there we go. Just as a backdrop to all of this, I think our goal is all the same. Our long-term goal is to have this heifer calf calve in as a springer at somewhere between 22 and 44 months of age, healthy, well-grown, hopefully 85% of her mature body weight. And what we do with this as a calf is setting her up for that future success or failure, as the case may be. We have to get her started right. So how do we promote calf health and growth, which is really setting the foundation for her lifetime performance? There are two big buckets, if you will. The first is we need to maximize immunity, and we do this through a number of things, colostrum management being one, but nutrition is very, very important. Minimizing stressors, for example, environmental stressors like cold stress or heat stress would be examples. And vaccination can play a role in some herds as well. The other big bucket is to minimize infectious disease challenge. There are certain infectious agents present on every dairy. We know they're there. The question is simply, what will be the level of challenge or exposure of those agents to the calf? And if we can minimize or reduce that challenge, the calf has got a better chance of fighting off a mild challenge than it does a severe challenge. And examples would be E. coli, rotavirus, coronavirus, maybe Clostridium, things like that. So here we need to think about our choice of housing system and how we manage it. Bedding management, clean, dry, comfortable. Ventilation, we need good air quality. And then, of course, sanitation. So between these two big buckets, maximizing immunity and minimizing challenge, hopefully we tip the scale in the right direction and achieve a healthy calf. So these are, it's kind of a long list of items here. We're not going to cover all of them today. We're going to focus just on colostrum today. If there are questions about any of this other stuff, feel free to drop me an email or give me a call sometime down the road and we can chat about other things. All right, so if I ask any of you, why is colostrum important, or if I ask our vet students, what's in colostrum that makes it so important to the calf, everybody knows the answer. It's the antibodies, right? So colostrum is chock full of high levels of antibodies or immunoglobulins. The newborn calf will ingest the colostrum. It's going to absorb those antibodies out of the gut, cross into its blood or circulation. And for the first several weeks, days, weeks, and months, those colostral antibodies are at high enough concentration to help fight off or ward off infection if the calf is challenged. that buys the calf time to produce its own acquired immune response and to produce its own antibodies. So hopefully after a number of months, it should be operating fully on its own steam. So everybody knows about the antibodies, and it's absolutely true. That's one of the first things we think about. In research, we measure immunoglobulin G or IgG because it's the most common or the dominant kind of antibody found in colostrum, but there are other kinds, IgA and IgM, IgE as well, but in smaller quantities. But colostrum just isn't about the antibodies. There are a lot of other goodies packed into this bucket, if you will, that are helping the calf from an immune status point of view or possibly growth point of view. One of the things that we're still learning about is white blood cells or leukocytes. In normal fresh colostrum, we have in excess of 1 million somatic cells or leukocytes, white blood cells, per milliliter of colostrum. Now, if I told you a cow had a 1 million somatic cell count at any other time of the lactation, you'd all be thinking mastitis, right? And you'd be right. But colostrum from a healthy, uninfected gland has 1 million somatic cells, leukocytes or white blood cells, and this is normal. It's made up of macrophages, neutrophils, lymphocytes. Some of these, not all, but some will be absorbed across that open gut from the colostrum. It'll sit in the local lymphoid tissue for a couple of days and then they die. What we don't know is why they're there, what they do. There's a little bit of research that says that they will modify or tweak to some degree the calf's developing immune system. But what we don't know is if those little tweaks are relevant, if they actually result in a healthier calf. So that's one area of research that people are continuing to poke away at. For the moment, though, we don't know if these cells are relevant. Are they good? Are they bad? Neutral? We don't know. Other factors in colostrum that will help stimulate the immune system or gut development, there's a lot of them. Cytokines, interferons, interleukins, there's growth factors, there's hormones, vitamins and minerals are there in higher concentrations than normal. Trypsin inhibitor, that's a compound that prevents the stomach from actually digesting and utilizing the colostrum protein like they would another just regular nutritional protein. So it protects the IG so that it escapes through the stomach and can be available intact to be absorbed in the small intestine. There are non-specific antimicrobial agents like lactoferrin or lysozyme in high concentrations. It acts as a fluid source to increase blood volume. And then there's the nutritional component. So that's going to be shown on the next slide. Here we've got various categories of nutrients described. For first milking colostrum, second or third milking, we call that transition milk or transition colostrum, if you will. And then finally, in the last column, you see saleable tank milk. Now, if we just compare the total solids alone, and this would be for a Holstein, tank milk has roughly 12.5% total solids. Meanwhile, colostrum is roughly double that. And you can see a lot of those extra solids are coming in as added fat and a lot of added protein. There's extra vitamin A here. There's other extra vitamins as well. I've just got vitamin A as an example. But you can see that the nutrients are really packed into colostrum that we don't find in regular milk, at least at the same high levels. So these nutrients are going to be really, really important to getting the calf off to a good start, especially if you're born in the wintertime and you need extra calories to burn for thermogenesis or heat production and to support maintenance and growth. The other thing that's kind of an interesting question, and there's a lot of research active here right now as well, is this question of epigenetic programming. What this means is factors, whether they're nutrients or other factors that might be in colostrum or in the milk program, or maybe during exposure in utero, that will turn on or regulate the expression of genes within the fetus or the calf. And that gene expression could affect its health, its growth, or its future performance, both in the short term or possibly even the long term. An example of this from some recent research was the effect of heat stress on pregnant dams in the last trimester. The study compared heat stress dams versus non-heat stress dams, and they reported that calves that were born to heat stress dams had lower absorption of IgG from colostrum. Longer term, they had poorer reproductive performance as yearlings, and really long term, they had first reduced first and second lactation milk yield. And so the people who did this research are holding this out as an example of epigenetic programming, the heat stress. While there are questions about colostrum as well, are some of those many components in colostrum also having an impact on the short or long-term health and growth and performance of calves that we could put under the epigenetic programming label? We don't know, but it certainly could be part of what we see as contributing to the benefits of colostrum. So what do we consider a successful colostrum program? We can measure this, and we call this successful transfer of passive immunity. Those antibodies are produced from the dam, put in the colostrum, passively absorbed into the calf circulation. And most people will agree that successful passive transfer is, if we bleed that calf, collect a blood sample somewhere between 1 and 7 days of age, measure the serum immunoglobulin G level, the goal should be at least 10 grams per liter or higher. And we know from NOMS data, from multiple other studies, that if your serum IgG levels are less than that, that being a failure, we will see more illness, more morbidity, higher treatment rates, and higher mortality rates. And I'm sure you're all familiar with that relationship. But there are other longer-term benefits as well that people need to be aware of. With improved levels of passive transfer, we see improved rate of gain and feed efficiency. Well, if we grow them faster, that means we can breed them at an earlier age at the correct stature and decrease their age at first calving, which is a huge economic benefit to you. And if they don't get sick, if they're growing well, we can see increased first and second lactation milk production. So if it takes you 5 or 10 minutes to provide that first feeding of colostrum to that newborn calf, and you're grumbling because it's cold, you want to go to bed, you want to go watch the game, whatever, just remember it's 5 or 10 minutes that's really well spent, because you're going to get paid back many times over in both the short and the long-term benefits. This next slide describes the current, or roughly current, incidence of failure of passive transfer or passive transfer of passive immunity in US herds according to the last few NOMS studies. And these are the big national studies that the USDA NOMS group runs every 5 or 6 years. So what we have here is the data. This is the serum IgG results from the NOMS study that was run in 1991, 2007, 2014. And just to summarize it, in 1991, 41% of heifer calves had failure passive transfer, meaning basically 2 out of every 5 calves failed. By 2007, that had dropped to basically 1 out of every 5 calves failed, so we're getting better. And in 2014, it had dropped to roughly 14% failure rate. So as an industry, we are doing much better. And then there's certain farms out there, lots of farms who are just knocking it out of the park right now, doing a really awesome job with colostrum management. But on average, over the whole industry, there is still an opportunity to improve. 14% failure rate is getting better, but we want to see that at less than 10%. I'm going to talk about that in one of the next slides coming up. So if you buy into the argument that colostrum is important and you're not bored silly by the topic, I know we've been talking about it a lot of years now, what I'd like to do for the rest of this presentation is talk about how we build a functioning colostrum management program. We're going to talk first about how do we measure how we're doing in terms of monitoring, and then the components of building the program itself: quality, quantity, quickness, and cleanliness. So we'll start with monitoring. Now, the gold standard for measuring passive transfer of IgG would be to bleed the calf, send a serum sample off to a lab, and measure serum IgG. That's the gold standard. However, that's expensive, it takes a lot of time, and it's just not going to be done on a routine basis for herd level monitoring. So what we typically do instead is we'll use serum total protein. That's a refractometer measurement, which at least in the first week or so of life is positively correlated with serum IgG. So serum total protein is a cheap, really simple test that can be done on farm or at your local vet clinic. And if we do a group of calves, we can do a herd level interpretation and decide if the program is working or not. So in most studies, if we're looking for a serum IgG value of 10 or greater as being a pass, the corresponding serum total protein value will be a 5.0 to a 5.2 grams per deciliter, or in that range. So how do you measure this? Like I said, it's a herd level monitoring tool. You're going to go and you or your veterinarian, whomever, will collect blood from 12 or more clinically normal calves that are between 1 and 7 days of age, separate the serum. You don't need a centrifuge to separate the serum. You can just collect the blood in a red top tube, stick it in the fridge, and leave it overnight or for 1 or 2 days, and the clot will retract naturally on its own, and you will have a big enough drop of serum. It's not huge, but enough serum to do your test. So if the vet wants to do it and they've got a centrifuge, that's great, but you can do it on farm without a centrifuge and get the same results. So you're going to bleed 12 or more clinically normal calves. What I mean by clinically normal is not, you know, scouring and grossly sick, you know, sunken-eyed, depressed, that kind of thing. You want something that looks reasonably healthy. All right, you go take your serum, you run it over your serum total protein refractometer. And like I said, the goal is you want a 90% pass rate, meaning at least 90% of the calves tested will be at or above a 5.2 on the serum total protein scale. Sheila McGurk used to suggest 80% at or above a 5.5. Either way, I think you're going to come up to a similar conclusion about whether the program is broken or working. Now, this goal of just 90% pass and you're good, that's somewhat of an old goal. The corresponding goal, if we were using a Brix refractometer for the serum, we would like at least 90% of calves to be at or above 8.4% on the Brix scale. So if you don't have a serum total protein refractometer, but you do have a Brix refractometer for monitoring colostrum, we'll talk about that later, you could use that same instrument to monitor, to take the serum measurements, and it works equally well to the serum total protein refractometer. Anyway, our goal is a 90% pass rate or better. That was the old goal. And a lot of you out there today, I'm sure, are achieving this goal and doing very well. The question has come up over the last 10 years or so, though, is higher better? You know, 5.2 is a pass. Well, what if I can get to 5.5? What if I can get to 6? What if I can get to 6.5? Is higher better? And is dichotomizing at, you know, just a simple yes, no, pass, fail, is that too simplistic? So to address that question, this is something new that you're going to be hearing today. Jason Lombard, here's a picture of Jason. He's the leader of our team he works at Fort Collins for the USDA, and he's been organizing and running a lot of these NOM studies over the years. He put together a team to look at reviewing the literature over the last 10 years or so, and trying to decide if we need new goals. Can we come to a consensus recommendation on goals for levels of passive immunity? Is the old goal still valid, or should we be setting our sights a little higher? So he assembled a panel of experts, calf experts that had done, you know, calf research over the last little while. We reviewed a number of papers published in the last 10 years. I'm just showing an example of a few of those papers here, where in each of these studies, the authors actually reported, yeah, if you can get higher than 10 serum IgG or higher than a 5.2, higher yet, there are incremental benefits in health. Higher does appear to be better. And then what we did was we looked at the NOMS 2014 dairy study data, because that's the most recent, biggest database available to date, and asked a similar question, is higher better? So what I'm going to show you here is a survival curve. So this is death loss between birth and weaning. So on the x-axis, we've got days of age from 0 to 60, with 60 being roughly age at weaning. And on the y-axis, the probability of survival. And you'll see here, instead of two groups, pass-fail, Jason and his grad student figured out that there were roughly 4 different groups that it made sense to split the data out in as per their serum IgG level. So poor is the brown line. That's a true fail, less than 10 grams per liter. That does not change. Fair was 10 to 18 grams per liter IgG. That's the green line. Orange line is good, 18 to 25, and excellent is the blue line at 25 or greater. And so what we can see here is if you fail, if you've got less than 10 grams per liter serum IgG, yes, you are absolutely at higher risk of dying between birth and weaning, and roughly 10% of those calves died before weaning. However, it wasn't just everybody after that is the same. If you could get to the green line, that was better, sure. But if you can get into the good or the excellent group, things are better yet. So there was a further reduction in mortality risk if serum IgG could be 18 grams per liter or higher. This is a similar survival plot, but now instead of mortality or death loss, we're looking at morbidity or treatment rate, just for illness. And again, we can see if you're in the POORS group with serum IgGs less than 10 grams per liter, yes, there's a much higher risk of being treated for some disease prior to weaning. 65% roughly of those calves were treated for one illness or another. But if we can move up into the fair group, there's an incremental improvement, good group, an improvement again, and the excellent group, a further reduction in morbidity. So based on this data, and this is from a pretty big data set, like I said, the NOMS 2014 data set, the group came up with these new consensus recommendations for goals for monitoring levels of pass immunity in dairy calves. So instead of just a pass-fail, where fail would be less than 10 and pass would be greater than 10, now the pass zone, greater than 10 grams per liter, is now broken into a fair, good, or excellent range. And here are the corresponding serum IgG levels that we would classify for fair, good, or excellent. Now, it's unrealistic to think that 100% of calves are going to achieve excellent. It's just not going to happen. But what we were able to do with Jason's data is look at, well, what is realistic? What is achievable in the better herds? And so this, in the middle column here, this is the proposed proportion of your calves that would fall into each category if you were really knocking it out of the park and achieving these higher cut points or higher goals. So again, still 10% or fewer of calves would be in the failure zone or the poor zone. Roughly 20% would be in the fair, 30% would fall in the good, and 40% or more would fall in the excellent. And so if you're currently doing well, you're 90% pass rate, the next time you go bleed your calves or going forward, if you want to see if there's further room for improvement, getting it higher yet, start classifying your calves into these fair, good, and excellent zones, and over time get a sense of what proportion are falling in those ranges and see how you're doing. Now, you're not going to have the serum IgG levels probably, but you will have serum total protein or BRICS readings. So here would be the equivalent recommended serum total protein levels. So 10%, 5.1, less than 5.1, 20% would be in the 5.1 to 5.7 range, 30% 5.8 to 6.1, and 40% would be 6.2 or greater. That's if you're using the serum total protein refractometer. If you're using a BRICS refractometer, here are the ranges that are recommended there. So paper's been put together, it's been submitted, it was just accepted actually, so the slide just says in preparation, but it's just recently accepted by Journal of Dairy Science, so this should be out in the literature hopefully within a few months. And if anybody has questions about that, they can come back with questions later, or like I said earlier, call me or drop me an email and we can talk about it. Okay, so that's new, proposed new goals. Now, how do we get there? So the next thing I want to do is quickly go through the quality, quantity, quickness, review the basic principles, talk about anything new there, and then we'll talk about cleanliness as well. All right, so we'll start with colostrum quality, and this goal has not changed. Good quality colostrum is considered to be 50 grams per liter or higher in IgG concentration. This is a scatter plot, just plotting from some Midwest cows. This is from 225 cows from roughly 12 herds from a study we did way back when. On the x-axis is the colostrum IgG concentration. On the y-axis is the serum IgG concentration in the calf that consumed that particular aliquot of colostrum. And it should be no surprise to anybody that there's a positive relationship. If you consume more grams of IgG, you will absorb more grams of IgG, will measure a higher concentration in your blood. So that's not a surprise. But I think what's interesting about this plot is also look at the variation in the colostrum quality between these cows within these 12 Midwest herds. Maybe 25% of cows are failing they're below 50 grams per liter of IgG, and 75% are passing. I would like to know, what are the factors that are under management's control that cause these cows to fail and these cows to pass? And really, you know, how can we get cows producing colostrum that's not just 50, but 80, 100, 150 grams per liter? How do we get this liquid gold out of our cows? So what are the factors that affect colostrum quality? So we're going to come to that question next. In terms of what the industry is doing across the US, this is the data from the last NOM study. In that study, the mean colostrum IgG level was 75 grams per liter, so that's really good. And of all of the samples tested, there were over 2,500 heifer calves evaluated here in colostrum samples. Of all the samples tested, 77% were a pass, were greater than 50 grams per liter. The remaining, however many, were failures. So on the whole, we're doing really well in terms of average quality, but there are individual herds perhaps out there that could work on improving quality. So what are the factors that affect colostrum quality? There are some factors that you do not have control over. Breed, you're going to pick whatever breed you'll want to milk because of economics or because you like that colored cow. Age of cow, we can't change the age of the cow. But there are a certain number of factors affecting quality that are under your control that you might look to see if you need to tweak or if there are opportunities to tweak. The first one I've got on my list here is the dry cow vaccination program. There are some vaccines we give during the dry period to protect the cow. There are other vaccines that we give during the dry period that are specifically to target the quality of the colostrum to be passed on and protect the calf. And so these are typically the vaccines that include that target the scour's pathogens. One example would be scour boss that is going to cause the cow to produce antibodies against E. coli, rotavirus, coronavirus, and a number of clostridial bacteria, all of which can cause scours or diarrhea in calves. So I routinely recommend that people have one of these types of vaccines in the dry cow program. The next thing I have on my list is to feed a balanced dry cow ration. If you're already working with an experienced nutritionist, you're balancing it, proper levels of metabolizable protein, energy, vitamins, and minerals. If your feeding management is good, fresh palatable feed always pushed up, always available, fresh water always available, you're probably in pretty good shape. Both for her future performance as she moves through her transition period, but also for the colostrum quality and volume. We want to avoid stressors to the cow. Heat stress is a big one. We can see a hit on both volume and quality of colostrum if we don't have heat abatement systems for our cows. And so our dry cows, they need it for their own benefit as they move through the transition period, not just for the colostrum question. But we want to provide our dry cows with the same heat abatement systems that we offer for our lactating herd. It takes about 5 weeks or more to produce high quality colostrum, and so our dry period length is an important consideration. Anything less than 40 days dry and our volume can be impaired. Anything less than 3 weeks dry, 21 days, both the volume and the quality will be significantly impaired. So pay attention to your dry period length. We don't want to get that too short. If you've got a cow drying off that you know is carrying twins, dry her off a couple of weeks early. Move her to the close-up pen a couple of weeks early because if she reads the textbook, she's going to calve a couple of weeks early. And then the last thing I'll mention, ideally, we will milk cows very soon after they calve to harvest that colostrum. I'm just going to show you on the next slide here the impact of delaying that first milking on the colostrum quality. So in this study, and there have been others that have shown similar results, what we see if we milk the gland out 2 hours post-calving versus 6, 10, or 14 hours post-calving, we can see a progressive decline in the relative quality of the colostrum that's harvested. And we believe most of this is probably due to a dilution effect in the gland. So ideally, we want to milk the cows within 1 or 2 hours maximum would be 6 hours. Now, not everybody has round-the-clock labor or the ability to do that. And if you're not doing that, don't beat yourself up just yet. So if you're looking down this list saying, I don't know, I don't do this, I might not do that, don't beat yourself up about it just yet. Before you do anything, go back and measure your colostrum quality and just see how you're doing. And so how we can do this on the farm really inexpensively, it's very easy to do. You can have the old glass colostrometer up here in the upper right-hand corner. It measures specific gravity that's correlated with IgG levels. If it floats up in the green zone, you've got predicted good quality colostrum. If it sinks down in the yellow or red, then it's poor. Now this is an okay test. The accuracy isn't wonderful and it is affected by temperature. So not a lot of herds, some herds use this, but not a lot. Certainly not the majority are using this test. But more recently, we've had people validate the Brix refractometer. Now this could be a digital Brix scale or a handheld optical Brix scale, either one will work. But the Brix refractometer is a little more accurate than the colostrometer, a little less affected by temperature. And so I think we're seeing more adoption on farms of people monitoring colostrum quality using the Brix refractometers, but either one can work. But my point is, why don't you go test some colostrum coming out of your cows if you're not already doing so. And I know many of you will be already, and that's wonderful. But see what kind of quality you're getting. My goal would be, of the next 10 cows that you test, 9 out of the 10 should have high quality colostrum. Or basically, I want a 90% pass rate. If more than 90% of your samples are passing, so on the colostrometer, that would be in the green zone. On the Brix refractometer, that would be a cut point of roughly 22%. If you're getting a 90% pass rate, you're probably doing just great, and don't worry about it. If it ain't broke, don't fix it. But let's say you had a 50% failure rate, then what you could do is go back up to this list here and see if there are opportunities to tweak any of these management strategies that could allow you to improve colostrum quality going forward. All right, so that's quality. We're going to move on to quantity next. The question is, what volume should we provide at first feeding? In order to achieve our old goal of a 90% pass rate, we used to say you want to feed 150 to 200 grams of IgG. In order to reach our new goal, with those higher cut points, we're estimating that you want to get about 300 grams of IgG into the calf. So the question is, what volume do you need to feed in order to get 200 or 300 grams into the calf? And the answer, of course, is, well, it depends. It depends on the quality that you're feeding. And we don't always know the quality, and we don't want to be doing math in a barn. So what do? We just feed us a big enough volume, and assuming our quality is reasonably good, then we'll hedge our bets by feeding a large volume, and most of the time we should be there. So the recommendation is to feed 10% of the birth weight of the calf, which for an 85-pound Holstein heifer calf is roughly 4 liters, 4 quarts of colostrum, close enough. Now, you may be looking at that 300-gram goal and say, I don't know how 4 quarts or 4 liters is going to get there. Well, remember the last NOM study, the colostrum quality I mentioned? The average colostrum quality was 75 grams per liter. 75 grams per liter multiplied by 4 liters equals, guess what? 300 grams. So on average, herds are already getting here. And the really well-managed herds are getting here 90% of the time. They're doing it. They're already there. So it is an achievable goal. Now, how are you going to deliver the 4 quarts or 4 liters of colostrum? You've got 2 options. Basically, you can use a nipple bottle or an esophageal tube feeder. I know some people prefer the nipple bottle, and that's totally fine. Some people want to get it done quickly, so they're going to use a tube feeder. That works equally well. It really doesn't matter. As long as you're trained on how to safely, properly place that esophageal tube feeder, it doesn't matter. We can get equally good results with either delivery system. Now, I don't want people tubing calves multiple times. I'm happy tubing the calf once for that first colostrum feeding, but when we come back at the second or third feeding of colostrum or milk, whatever the case may be, I would like to see people moving either to a bucket or a nipple bottle for that second and third feeding and beyond. The reason is with multiple tubings, we can see damage, trauma, and problems arise. So if you're coming back at let's say at 6 or 8 hours after the first feeding and you fed a big meal, a big 4-quart meal at the first feeding, and the calf just isn't hungry, don't panic. Don't think, oh, I've got to tube this calf because it's not nursing, just leave it alone, come back at the next meal. It just needs some time to digest that huge, big, fatty first meal. Think of Thanksgiving dinner. It's going to take some time. And then at the next meal, it'll be hungry, it'll be ready to go. So just don't panic. One tubing only, and then move to a bottle or a nipple bottle or a bucket after that. This next slide just shows you some results from one of several studies that have been published now showing passive transfer rates in calves that are bottle fed or tube fed. They're not different. We've got the serum IgG level here in 2 groups of calves in the study that were fed by either nipple bottle or tube. They're the same. As long as you get the volume in, it doesn't matter how you get it in, you're going to do equally well. Now, for those of you who are feeding with a nipple bottle, you probably know that not every calf is going to want to voluntarily consume 3 or 4 quarts from a nipple bottle. So what's your backup plan going to be? It could be you're going to transfer the rest into an esophageal tube feeder and deliver it that way. Or if you prefer to delay, then you can wait for another, let's say 4 hours, and then come back and provide a second feeding. Either approach can work. Just be prepared with a backup plan, because as you know, they won't all consume 4 quarts from a nipple bottle. Okay, we've been talking a lot about quality. One of the questions that come up somewhere along this conversation, so I'm just going to interrupt, we're going to go on a little tangent right now, is what about the volume or the yield of colostrum produced? Occasionally from time to time I get calls, other people get calls from producers saying, well, my quality's fine, but the cows just aren't producing the volume that they were last month. What's up with that? And the short answer is, well, we don't know for sure what's up with that. We have some theories, and I'm going to talk about those on this slide. I'm going to present some data from a study published a couple of years ago. It was a 1-year study of 1 Jersey herd in Texas, where they measured the volume produced. They weighed the volume produced from every cow that calved in that 1 year. And then they tried to see if there were associations between the weight of the volume produced, or sorry, the weight of the colostrum, the volume of colostrum produced, and either cow factors or seasonal factors, other factors that could be maybe explaining variation in volume produced. So they identified several cow factors that were associated with a low yield, the low yield being roughly 2.7 liters or roughly 3 quarts or less. One was lactation length, short days dry. We already knew about that one. Cows carrying twins and older dams, they were all at a little bit higher risk of producing a low yield. But the other thing that was really interesting that came out of this study was there were some seasonal factors that that were identified here as well. And specifically in the months that preceded calving, so in the month that the cow was in her close-up period, if there was a decrease in the temperature humidity index in Texas, or a decrease in the photoperiod length, so short day length, they saw a decrease in colostrum yield. So looking over at this plot here in this graph, what we have here are the 52 weeks of the year with the lowest point. So the solid line here is the colostrum volume. And you can see right around Christmas is when things are at their worst. And then as we swing into spring, they come up again. So summer's okay, fall starts to decrease. It's at its nadir during the winter, and then it comes up again. Correlated with that is that if the temperature humidity index is falling or the photoperiod is dropping, meaning shorter day lengths, both were associated with lower volume of colostrum produced. Now, is this association cause and effect? We don't know for a fact. It was only 1 herd, but it does beg the question whether, especially that photoperiod thing, maybe there's something ingrained in the evolution of cows where they're still programmed by the photoperiod, and shorter day lengths maybe do impact on the volume of colostrum produced. We don't know, but it definitely deserves further study. One thing this study was not able to do, and this is another hypothesis that people have, is whether or not the dry cow nutrition program, especially the close-up ration, is potentially impacting the volume of colostrum produced. So there are theories, there's anecdotal reports that if we get our energy level, our starch level, our metabolizable protein levels too low in that close-up ration, that could negatively impact colostrum volume as well. At the moment, those are testimonials. There's probably something to it, but we need more research to tease that out. So for the moment, it might be a fall time risk factor. If you are getting low volumes produced lower than what you need, have a look at your ration with your nutritionist and see if there's an opportunity to tweak energy or metabolizable protein. But basically, we're still working on this question. And in the meantime, the solution, my recommendation would be, well, if you have shortages in the fall every year, then bank colostrum. If you've got a surplus in the spring and the summer, bank any surplus, put it in the freezer so that as you enter that fall period, that higher risk period, you'll have some put aside. Okay, so that's quality, quantity. Quickness, time to first feeding. I think most of you are probably familiar with this concept that the calf is born with an open gut that can absorb these large protein molecules intact, but over the first 24 hours of life, the gut closes. Basically, the epithelium lining the gut it turns over and it loses its ability to absorb IgG. So what this diagram shows, it's just depicting how the efficiency of absorption of IgG, or the proportion that we feed that's actually absorbed into the blood, it starts out at maybe 30, maybe 40% absorption rate, but over that first 24 hours or so, it gradually declines. And then roughly at 24 hours, give or take, it's closed. So we've lost our window of opportunity to absorb Ig after that time. So how quickly do you want to feed our calf? Obviously, we want to feed it ideally within 1 to 2 hours. If you could get 90% of your calves fed by 6 hours, you'd be in pretty decent shape. Now, this is the point where people ask, well, would a second, oh, sorry, I'm skipping ahead. I want to talk about this slide first. I just wanted to show you one recent study that demonstrates very nicely the importance of that early colostrum feeding. And in this particular study, there are 3 groups of calves that were randomly assigned to be fed either at 45 minutes after birth, 6 hours after birth, or 12 hours after birth. So what we have here is the graph showing the serum IgG concentrations in these 3 groups of calves over the first 48 hours of life. And obviously the group of calves that is fed within 45 minutes, their serum IgG rises very quickly, whereas it's delayed in the 6-hour and the 24-hour group, predictably. But what's important, the important take-home message is look at the peak. So if you're fed earlier, they peak at a much higher concentration, roughly 25 grams per liter in the blood, whereas if they're fed at 6 hours or 24 hours, they peak at a much lower rate or lower level, and we can attribute that to the impaired efficiency of absorption. Even 6 hours later, that's significantly impaired. So the take-home message is feed them as soon as you can. Okay, so that said, if you get 4 quarts in the first feeding, do you need a second feeding? Or is there value to a second feeding or a third feeding, or feeding even after gut closure, after 24 hours of age, when we know that they're not going to be able to absorb those antibodies into the blood? And the answer is, yeah, there is some value to it. And for herds that are struggling with, a higher than desirable scours incidence, crypto in the first 7 to 14 days or what have you, this could be one of the management strategies that you adopt, is providing a second, third feeding of transition milk, or even feeding beyond gut closure. So what I want to do is show you some results from a study published a few years ago now, where they actually had 2 groups. Calves were allocated to 2 groups. The first group was fed just milk replacer. It was a 28-20 blend, fed 3 liters twice a day. So that the treatment period was for 14 days. And then in the second group, they got the same milk replacer program, so 3 liters twice a day of the 28-20. But for the first 14 days, they also added 150 grams of a colostrum supplement to each feeding. So in fact, they were adding 32 grams of IgG to each feeding twice a day for 14 days. So it's milk replacer with or without the colostrum supplement. I'm going to show you the table of the health data here. So we've got the colostrum supplement group, or the control group, 100 calves per group. The scours incidence, this is in cases per calf days at risk, was 0.03% or 0.3%. So a 10-fold increase in scours risk in the control group. Respiratory disease, also a significant reduction in risk for respiratory disease in the colostrum supplement group versus the control group. In antibiotic use, only 19% of calves were treated in the supplement group versus roughly 76% of calves in the control group. So we can see there's a dramatic improvement in calf health if we were able to supplement their milk with the colostrum supplement. Now, what did that intervention cost? If we look at the cost of what they were doing, it was roughly 12 bucks per feeding times 28 feedings. It was a $345 intervention. That's pretty pricey. I think most people would agree. And is there a return on that investment? Well, we don't know. They didn't measure any long-term outcomes or offer any economic analysis in this paper. But I'm showing you this data, even though it was a pricey intervention, I'm showing you this data to show you the proof of concept that post-gut closure, there is value to having some antibodies or some colostrum in that milk. So how can you do it? There are different options. Some of them are going to be less expensive, some are going to be more expensive, but at the very least, if you, like I said, if you're struggling with a little more scours post, in the first week to 2 weeks than you like, maybe providing a second or a third feeding of transition milk can help if you're struggling and if you can implement it properly. Now, if you're just feeding one feeding, 4 quarts of colostrum, one feeding, and you're getting excellent calf serum, blood work, and your health is great, then don't worry about a second or third feeding. If it ain't broke, don't fix it. But if, let's say, your passive transfer rates aren't quite what you want, and or if you're still seeing more scours than you like, this could be a management tweak that might be worth trying for a little while. So that's the second or third feeding. Post-gut closure, people have talked about adding, you could add the colostrum supplement as was described in this study, or maybe adding frozen colostrum ice cubes from surplus colostrum to your milk replacer or milk feeding for the first 10 or 14 days. We don't exactly know what dose, how many cubes, and it had better be clean colostrum, not mycoplasma colostrum, but potentially this could help. If you're feeding pasteurized milk to your calves, then I would strongly recommend that you put your transition milk, that second or third milking, into the pasteurized milk pool, and then everybody benefits. Okay, so that's the post-gut closure discussion. Okay, the last thing, and then we'll wrap up. Last topic we wanted to talk about was the cleanliness of the colostrum that you feed. Quality, quantity, quickness are by far the most important things to get right first. But after that, there is some opportunity to make further improvements by focusing on the level of bacterial contamination or cleanliness. Now, why do we care if there are bacteria in colostrum? One reason why we may care is because if those bacteria happen to be pathogenic, then they could cause disease in the calves. And examples would be E. coli or Salmonella, Mycoplasma, or Mycobacterium avium subspecies paratuberculosis, which is the agent that causes Johne's disease. Any or all of these could be shed in colostrum or found in colostrum. So we don't want to feed those. The other reason we would like to feed clean colostrum is that we've learned over the years that high bacteria levels in colostrum are associated with impaired absorption of IgG. The scatter plot is just data from one of our studies that shows this relationship. We've got over 1,000 calves here. On the x-axis is the bacteria, this is the total coliform count in the colostrum that was fed, and on the y-axis is the serum IgG level in the calf that was fed that particular aliquot. And there's a lot of scatter in the scatter plot, but there is a significant negative relationship whereby the higher the coliform bacteria levels, the lower the IgG levels. And we've got, at least a 5, 6, 7% or 7 gram per liter difference between the highest and the lowest calves here on average on this regression line. So that's significant. We don't know what's going on here. It may be that the bacteria are physically blocking the absorption sites in the gut. It could be that the bacteria are binding and neutralizing or are neutralized by the antibodies, which is a good thing. But that just means that there's one less antibody available to be absorbed. Either way, these are two good arguments for wanting to feed clean colostrum. So what is clean colostrum? If you were to culture your colostrum, let's just say it's regular, fresh, not heat treated, we'd like the total plate count to be less than 100,000 CFUs per milliliter, total coliform count less than 10. How are we doing as an industry? This morale study sampled 827 samples from 4 dairy regions around the country. They tested quality. They also cultured them for bacteria levels. And in this particular study, 43% of the samples failed, meaning that they exceeded the 100,000 CFU per mil limit. So there's an opportunity to clean up our colostrum on the average dairy. Now, how are things on your dairy? Well, you know, before you get too worried about it, why don't you just go out and take some measurements, freeze some colostrum samples, just put them in a mastitis sample tube, throw it in the freezer, label it, and then pass it off to your vet, have it taken into a lab that can do multiple dilutions, and just have them do a total plate count on a handful of samples and just see how good or bad things are. If you're doing well, great. If you're not, if things look contaminated, then we need to go looking for the sources of contamination, and that leads us to this next slide. So as I see it, we've got 3 major sources or origins of bacteria that might contaminate the colostrum. The first is from the cow. So this could be that we've got, she's subclinically infected with something and she's shedding it in the colostrum. Salmonella or mycoplasma would be examples. Or it could be that she's got fecal material caked onto the teat skin, and if we don't do a proper job prepping that teat before we attach the milking unit, we could wash that manure and all the bugs that are in it into the milking bucket. The second source is from dirty equipment that's used to harvest, store, or feed colostrum. And then the third source of contamination is from bacterial growth or proliferation in stored colostrum. So what I want to do is just quickly go through the critical control points for each of these 3 points of contamination. So how do we prevent bacteria arriving from the cow? Well, we prep the udder, do a decent job prepping, cleaning, sanitizing, drying the udder before we milk her. We don't let the calf suckle the dam, because while the calf is nursing, it's having, eating its little manure meals off the hide or off the teat. If we know that a cow is subclinically infected, for example, if you're doing testing for Johne's disease or MAP, if you have a positive or suspect cow, don't feed her colostrum. And finally, we avoid pooling raw colostrum. That way, if one cow was shedding myco, if you use the 1 cow to 1 calf rule, then only 1 calf gets exposed. Whereas if you pool her colostrum with other cows and then feed that to multiple cows, now we've exposed multiple calves. So if you're feeding raw colostrum, use the 1 cow to 1 calf rule. Don't pool. Equipment, it just comes back to cleaning and sanitation of any equipment that's going to be used for harvest, storage, or feeding. And there are simple tests. You can use your eyeball. There's the fingernail gunge test. If you can see gunk, then it's dirty, okay? We can get more sophisticated. We can do swabs and cultures. We can take little bioluminescence meters, ATP swabs, and actually quantify the DNA that are on surfaces. But the bottom line is, if it's dirty, then we need to develop protocols for properly cleaning and sanitizing. And if you're not comfortable with that, then drag in your vet or another consultant that can help you find those protocols, put them in place, do the training, and then monitor the outcomes. This is just an example of the contamination that can come from dirty equipment. This is a study we did a number of years ago where we, on 40 just fresh cows, we sampled, well, we cleaned and prepped the udder first, and then we scrubbed the teat in with alcohol and collected an aseptic sample from the quarter, just like you would an aseptic sample for a mastitis culture. That was sample 1. Then we put the milking unit on, and we bucket milked her, and we collected a second colostrum sample from the bucket. And then we transferred that into an esophageal tube feeder and collected the third colostrum sample out of the end of the tube feeder. That's what the calf would see. We cultured all 3 sample points, again, times 40 cows. And what we have plotted here is the average. This is the log of the total bacteria count. Anything greater than a log score of 5 would be greater than 100,000, which is above what we want to see. So coming out of the cow, colostrum was pretty clean, and for the most part, it was negative. Unless she had mastitis or something, there should be no bacterial growth. But out of the bucket, now on average, we were sitting up and around the 100,000 marks, which means that half of our samples were above that. they were contaminated. And then in this particular study, we didn't see any additional contamination coming through the tube feeder. So evidently the tube feeder was clean, but the system that was used to harvest from the udder into that bucket was obviously not clean, because we were getting a lot of contamination there. So we used that data to go back to the farm, look at their protocol. You know, how often were they washing this bucket, and what was their protocol for cleaning and sanitizing it? And we were able to do that more often and with a better protocol, and things got better. Now, I don't expect there to be zero contamination. I expect some climb in bacterial levels. It's not going to be sterile, but we don't want you know, gross contamination of half of our samples. Okay, and then the last control point was bacterial growth or proliferation in stored colostrum. Now, one way around this one is just don't store it. You collect it, you harvest it from the cow, and then you feed it right up within 1 or 2 hours, and the bugs never really get a chance to start multiplying or proliferating. But a lot of people do like to store colostrum for convenience. They like to refrigerate it or freeze it. Fine. Just do that as soon as possible. So get it in the refrigerator, chill it down as fast as you can. And even in the refrigerator, you still want to use it up fairly quickly, because bugs will be growing, even though it'll be more slowly, they'll still be growing in the refrigerator. So feed it up within 1 to 2 hours, or freeze it. And if you've frozen it, it's good for, we think, up to a year. The use of preservatives, potassium sorbate is one preservative that has been approved, can be used legally to delay bacterial growth in colostrum. So I'm going to show you, this next slide shows bacterial growth in refrigerated colostrum. It was refrigerated for a 10-day period. On the y-axis is the total plate count. The red line depicts the total plate count of 100,000 that we don't want to exceed. And the dark blue line is just the bacterial growth in regular fresh raw colostrum, what most of you are probably feeding. So we start with a little more than 10,000 CFUs per mil on day 0. By 2 days in, we're averaging 100,000. And by 6 days in, we're up and around 1 million CFUs per mil. So this is why I say, if you're feeding regular fresh raw colostrum, you want to feed it up within a day or two, at least on this herd, because after that it's going to be polluted. The pink line is the same colostrum, but it's had the potassium sorbate preservative added to it. So it buys you a couple of extra days of shelf life. That's fine. And then this next graph adds 2 more lines, the green line and the blue line. This is heat-treated colostrum with or without the potassium sorbate preservative. So you can see if we heat treat it, we knock the bacterial levels down to really, really low levels, then assuming we put it in a clean container in a functioning refrigerator, we're going to have very, pretty decent shelf life. It's going to be a while before the bacteria get any traction and start multiplying. So that's what heat treatment would be expected to look like, at least in this study. But bottom line is, if you're using fresh, regular colostrum with no preservative, no heat treating, etc., you want to use it up within a day or 2. Okay, so that's the motherhood and apple pie stuff. Clean equipment, udder prep, proper storage conditions. Everybody should be doing that. It's cheap, it's inexpensive, and we want you to focus on that first to try to clean up your colostrum. But beyond that, there are a couple of additional management strategies that you could use. Colostrum replacers is one, and you're probably all familiar with this, and I think everybody should have probably a couple of bags of colostrum replacers sitting on the shelf for just in case you don't have colostrum in storage or refreshments without colostrum. These are not inexpensive, so you want good quality stuff. One comment I will make is some of these products are colostrum derived, meaning they come from spray dried colostrum. In other products, it's actually, the IG in them is actually serum or plasma derived. And what we've learned over the years is you're going to get better IgG absorption out of the colostrum derived products than you will the serum derived products. Just comparing 2 different studies comparing absorption rates and serum IgG levels in calves that colostrum derived versus serum derived products. The colostrum products win. Does that mean you shouldn't buy the serum products? Yeah, no, necessarily. It just means that you're going to have to feed more of the serum derived products in order to get to the same goal. And then the other thing is important to remember, dose is important. So I'll just show you that here. This is the Land O'Lakes product. You can buy it in a tub or a 100-gram dose bag. This is work from studies we've done where we fed 1 dose or 100 grams 1.5 doses, 150 grams, or 2 doses, 200 grams. And you can see if you only feed 1 dose, on average, we're not even making it to the 10 gram per liter mark. 54% of calves failed. If we feed 2 doses, then nobody failed. Now that's going to get expensive if you're feeding 1.5 or 2 doses. You are going to have to make that value call on your own. But if it's a high value calf, you may want to feed 1.5 or 2 doses to get to the higher levels of IgG into the calf that we're going to want to improve, further improve on reducing morbidity and mortality. The last thing I'll mention is heat treating. I'm going to skip a couple of slides. I'm getting a little long in my time here, but basically heat treating, you're going to take your fresh colostrum, heat treat it at 60 centigrade or 140 Fahrenheit for 60 minutes, and then transfer that into a clean receptacle, refrigerate it or freeze it, and then warm and feed to calves as they're born over the next day or two. You can heat treat in batch pasteurizers, or you can heat treat in individual bags for smaller dairies that can't create a large pool every day. You can put in the perfect udder bag and float in a batch pasteurizer. Maybe you've got the batch pasteurizer already because you're doing milk. Well, then just fill it with water or milk and then float the individual bag of colostrum in that using the proper 140 Fahrenheit for 60 minutes. This is a little dairy tech unit that was just put out in the last year or so where it's got room for 2 4-liter bags. So smaller dairies can heat treat smaller volumes, either individual bags or batches work fine. Now, this isn't widely adopted yet. If we look to all operations in 2014, only 6% of herds were heat treating. But if you break it out by small, medium, and large herd sizes, almost 25% of larger herds were doing this. It hasn't quite caught on yet so much in the small and medium herds. Probably as much about economics as anything else. The larger herds can pay for this equipment more easily because they can spread the cost out over more calves. I'm just going to skip a couple of slides here just very quickly and just show you what are the calf health results when we feed heat-treated colostrum. So this is a study we did a few years ago. We've got over 500 calves per treatment group from 6 large Midwest dairies. Half the calves were fed fresh colostrum, that's the light blue or whatever color. Half the calves are fed heat-treated colostrum in the whatever purple, maroon that is. What we've got here is the morbidity rate or the treatment rate for various diseases between birth and weaning. And if we look at death, loss, bloat, navel ill, BRD, respiratory disease, there was no significant difference. However, if we look at scours, there was a significant reduction in scours and a significant reduction in overall treatment rate if the calves are fed heat-treated colostrum. Now, do I look at this data and say now everybody's got to rush out and buy a pasteurizer and feed heat-treated colostrum? No. I think the take-home message from this data is everybody should rush home and feed clean colostrum. So go back to that motherhood in apple pie list, this list right here, and see what you're doing here that you can clean up, inexpensively. If you've still got an issue with dirty colostrum, or let's say you've got a salmonella or a mycoplasma problem that's circulating in the cow herd, then there are definitely places for heat treating colostrum, but it's just one additional tool. Okay, so that's it. Just to summarize on colostrum management, it is a cornerstone of a successful calf or young stock program. While we've definitely made improvements as an industry, there's still an opportunity for a lot of producers to further improve. And so here's what we need to look at, the 5 Qs. So we've got new goals for levels of passive transfer for monitoring. And then we've got our goals for quality, quantity, quickness, and cleanliness. With that, I have overspent my time. I apologize. But if there are any questions, I'd be happy to take any questions right now. Thank you.
Thanks, Sandra. And thanks everyone for your time. We do have some questions that have come in, and we will address those questions. I'm going to spend just a couple of quick minutes here with an overview of Scour Boss, just some high-level stuff. Sandra, are you able to allow me to share?
I don't know. Oh, there, how's that?
Okay.
I'd hit stop share.
Yes. Yeah, I think we're good. Can anyone see slides coming up? Do we have anyone able to see a slide? Healthy calves begin with Scour Boss. Are we seeing that?
I
Yep,
can
we
see it.
that.
Okay, great. Thank you. All right. Again, we will get to your questions, and appreciate everybody's patience here that can stay on longer. I know a lot of folks may have conflicting calls or meetings. So just want to hit some real high level things on Scour Boss. As Sandra mentioned, vaccination is a key component of helping to maximize the IgG, immunoglobulin, that we can get into the colostrum. She talked about all of the other important pieces of that. I'm going to spend just a couple of quick minutes on vaccination and how Scour Boss can fit into that picture on your farm. So what are the key benefits of vaccinating with Scour Boss products? We have the only three-way rotavirus protection on the market. There's 3 general G types with rotavirus infections, a G6, G8, G10. We have an isolate from each of those 3 G types. The most prominent G type in North America, in order, are G6, G10, and then G8. But I will tell you that in looking at some global data over the past decade, there seems to be some movement over time on which of the G types predominate in any given geography. So we feel like there's a good opportunity with covering all the 3 major G types that we see in the U.S. With Scour Boss is a good thing. 9 antigens in Scour Boss 9, and that's more than any other vaccine, bovine vaccine on the market. What makes up those 9 antigens? Well, we have 4 E. coli isolates, and they're listed here on this slide. And anyone out there has used our bovine equalizer product. These are the exact same E. coli isolates that we use to produce the bovine equalizer, the K99 fraction of bovine equalizer, are the exact same isolates that we have in Scour Boss 9. And again, the three G types of rotavirus, as well as coronavirus, and Clostridium perfringens type C as well. One of the other things Dr. Godden mentioned, that certainly colostrum starts to concentrate and be developed by 5 weeks prepartum. Scour Boss is ideally situated, ideally suited to get a really nice anamnestic response prior to the beginning of colostral antibody formation. And so with our timing on our label, you can give that in or at the end of lactation, right around the time of dry off, anywhere from 8 to 10 weeks pre-calving, and be on label. A real quick piece on product handling. As with all vaccines or really any injectable product, we want to always make sure to follow the labeled directions. So Scour Boss is labeled for an IM injection in the neck. And that's pretty important to make sure that we stay in the neck. And it does have an oil adjuvant, so we want to make sure that you use a proper needle size. We recommend a 16 gauge needle in either a 1-inch or a 1.5-inch needle length to give us the best results, the best experience with Scour Boss. And as you follow other BQA recommendations, make sure to change that needle frequently in the process of vaccinating. So I'm going to end it here on this slide here with my portion. Just a comparison chart of the 3 Scour's vaccines on the market today. You can see Scour Boss 9, we've got a 9 antigen profile. Most E. coli isolates on the market, 3 rotavirus strains, 1 of each G type. corona protection, Clostridium perfringens, and a little broader window of opportunity for vaccination on the label as well. I need to get back to the Q&A so that I can, I think what I'm going to do is I'm going to stop sharing. And then that way, Sandra, do you want to take back control? And that way, if you have any slides you would like to pull up in the process of answering questions, you can do so.
Okay, thank you.
Yeah. So we had a number of really good questions. A few of them can be kind of lumped in together. I'm going to start with one of the first ones that came through, which was a question, and we had a couple of different variations on this. A question on the new, you know, the interesting new developments around characterizing passive transfer, and specifically questions about elevated numbers over 7.5, if you will, and the effects of dehydration. Could you comment to how do you interpret, what are your suggestions for interpreting those serum proteins at the higher level?
Yeah, we don't have a lot of good data. We've just got, you know, clinical impression. It's a great question. I think probably I'm comfortable up to 8, 7.5 to 8, especially if I know it's a consistent, well-managed herds and they're consistently getting high numbers. I'm probably comfortable up to that level. But above that, I don't know. I mean, there's going to be some weird outlier calves that that's what they did. But I would just double check whoever's bleeding calves, just verify with them that they aren't sampling sick calves, because dehydration could be something that we do need to rule out. The other thing I'll mention is regularly checking the calibration of your refractometer instrument, whether that's a serum total protein refractometer or a Brix refractometer. Definitely you need to check the calibration on that frequently, because it can get out of whack and you could get low numbers, or you could get very high numbers that are actually in error. So do remember to check that as well. But yeah, above an 8 is kind of a suspect. But apart from just asking, was that a sick calf, there's not much we can do about it. Just, you know, training to make sure people aren't targeting sick calves.
Okay, thank you. Another, I'm gonna merge two questions on the same topic. I've got a question about, is anyone in a more northern climate in the U.S. repeating the Gavin work out of Texas and the Jersey herd? And another kind of sister question to that, could the water intake be a factor along with photoperiod and THI changes?
Okay, those are good questions. Not to my knowledge for the first question, but it's definitely a study that needs to be done, but it needs to be done not in one herd, but it needs to be done in like 100 herds, so that we can start to tease out other herd management factors, like looking at differences in diet, for example. So if anybody has any, you know, money they want to throw my way, we can start that study. It needs to get done for sure. I particularly want to drill down on the temperature, humidity, not the temperature, humidity, the photoperiod question, as well as the diet, and maybe there are interactions there as well. As to the water, I guess theoretically, water intake, if water intake were restricted in the close-up period, then dry matter intake will also be negatively impacted. We know that the two are correlated with one another. So, and we know that if we have a big enough impact on dry matter intake, we're going to put her in a negative energy balance, and that could affect both volume and quality theoretically. So yeah, that's kind of creating a story for how water could lead to impaired colostrum volume. Acute water deprivation, if you're thinking that, oh, the tank went dry yesterday and today she calves and has no volume, I suppose, but that's the kind of accident that's not going to happen very often. But chronic restricted water, I think that could have an impact through its impact on dry matter intake, theoretically.
Okay, thank you. We've got a question, and I'll give an opinion on this one as well. Sandra, what is the best timing for dry cow vaccination for best colostrum quality?
My pat answer is usually to read the label and follow the label of whatever product it is you're using. I think my impression, and Scott can comment on this, my impression is that we can move those vaccine events earlier, like, maybe the first one doesn't go in at dry off and the second goes in at move to close up. But, maybe the first one goes in 3 or 4 weeks before she's dried off, and the second one can go in at dry off or sometime after that. Moving it earlier is not a big problem, I don't think, but I'm not the immunologist. Scott can comment on that. The real error is leaving it too late. If you leave it too late and you give it too soon relative to the calving event, that's when we run into problems. It just doesn't have time to work.
Yeah, and I tend to agree with your comments, Sandra, that the closer we get to expected date of calving, especially inside of the 3-week window, when we know that we're going to have, and this is expecting calving, and we know we're going to have some biologic variation of what the amount of time is going to be from administration of a vaccine to the point that that animal might calve up to a week or possibly even 10 days earlier than expected. And we don't have much time for that animal to give an anamnestic response, produce the antibody, and then have those antibodies then transfer on into the colostrum. So certainly, and again, the label indication, I agree with. We certainly talk about giving our products on label. I did have another question. My esteemed colleague, Dr. Prentice, asked about colostrogenesis, and I'll paraphrase. And it seems like there's not a lot of data or information out there on colostrogenesis, and a lot of it is based off of a really old paper from the 70s in Australia. Are you aware of any newer work on colostrogenesis and
on the timing, or just the what
just
happened?
the mechanism and timing? Yeah.
Yeah, the mechanism, yes. The timing, no. There's really thin data on the timing, and like I threw out a number, like we need a 5-week window or more to do a decent job of it. On the quality side, there's not a lot of data to support the timing, other than we know if we get under 3 weeks, we're definitely behind the 8 ball. The mechanism, yeah, there have been several reviews in the last few years on detailed reviews on the mechanism. And if anybody wants to email me, I can send you those reviews. I don't want to get into it now, but yes.
Okay, got two questions about cooling and thawing of colostrum. Does the rate of cool down after pasteurization have any effect on IgG concentration? Can it be cooled too quickly?
That's a really great question, and I skipped past that slide, so I'll pull it up real quickly. Must-dos to heat treat colostrum. Keep your temperature at the right temperature, active and not passive heating and cooling. So you can't cool it too quickly. You can cool it too slowly. If you cool it too slowly, you can actually damage the IgG. And the reason is that even though the 140 degrees is safe, it's safe for 60 minutes. But if we stay there longer, like a lot longer, eventually we are going to do damage to the Ig protein. So if you just turned off the machine when it finished at 60 minutes and let it cool down very slowly, just exposed to ambient room temperature, I would predict we could severely damage the Ig levels by slowly cooling the colostrum. So I want it actively, quickly heated, cooled. So quick heating, quick cooling.
Okay. And there was a kind of a companion question asked separately about the ability or any risk of antibodies being this says kill the antibodies, but is there risk of interfering with antibodies during the thawing process?
Yeah, that's a good question as well, good consideration. So we know that if you're putting it in a bucket of hot water or a warm water bath, if the water that you're putting it into is really, really hot and it's exposed to that for a long period of time, yes, you can damage the Ig protein in it. So with our experiments or research to figure out heat treating colostrum, we know that above 141 Fahrenheit, roughly, we're going to start to damage IgG. So you want your hot water bath to be less than 140 Fahrenheit or less. But I wanted actually even less than that for a different reason. What I typically recommend is your hot water bath be about 115 degrees Fahrenheit. 120 degrees is the absolute upper limit. 120 is what we think of as dishwater hot for most people. You can just tolerate putting your hand in without burning, scalding your hand. Well, imagine, if you will, you're going to put let's say a bottle of colostrum in a bucket of 125 degree water, and you walk away and you plan to come back in 15 minutes and pull it out, but you forget, you get distracted with some other task, and an hour later, the whole bottle is now 125 degrees. If you tube that, you're going to scald the poor little calf's esophagus, stomach, you're going to do some serious damage. So that's why I recommend 115 degrees as your hot water bath temperature. That way, I mean, it may take a little bit longer to warm up to feeding temperature, but if you accidentally leave it there a little bit longer, it's safe. You're not going to damage the IgG, and you're not going to overheat it to the point that you actually burn that calf when you go to administer the colostrum.
Great points, and certainly very important, because I've anecdotally heard of that happening. It's not a good experience. Okay, Christy or someone, we've still got plenty of questions. I'm happy to keep going for as long as Sandra's available.
Yeah, I think let's keep rolling. We've got,
okay.
It's obviously a hot topic. One thing I do want to mention is that there was talk about the passive transfer, and Jason Lombard is presenting next week at our virtual conference. So if people are interested in hearing what he has to say, he will be presenting during the DCHA virtual conference next week. But yeah, certainly let's keep it rolling. This is going to live online for members to access as well. So I'm sure they have these same questions. If Dr. Godden's available, I'm happy to stay on.
Sure, and like I said, if anybody has questions that they don't get answered today, just drop me an email. I'm happy to get back to them.
Okay, we'll keep going. Sandra, a question on serum protein levels in Jersey calves. Is there a higher threshold level for Jersey? Question, or the person asking comments, I've seen data showing that Jersey calves generally have higher total serum protein IgG levels.
It's a great question, and the answer is we don't know. We don't know if they need higher levels because nobody's done an exclusive Jersey study that has the sample size needed to tease out, what should the cut point be for a Jersey. So the short answer is we don't know. So for the moment, we're just using the same goals, the same cut points as we would for a Holstein calf. That's absolutely true. You can get higher levels in the Jersey if you just squish more colostrum into them. I'm not sure that they need it or not. It comes back to what's the challenge, If the challenge is higher, then we do need more antibodies. If there's zero challenge, then you can get away with less. Most people, I think, are going to be feeding 2.5 to 3 quarts of colostrum to a Jersey, and if it's high quality colostrum, you're going to get consistently pretty good results. Dairy we work with in Minnesota here feeds 3 quarts. It's on average about 80 gram per liter, 80 to 85 gram per liter quality. And so those calves are on average getting well over 300 grams of IgG in 3 quarts. We're getting, because of their smaller volume of blood, we're consistently in the high 5s and 6s with those calves, and that's fine. We don't know though if higher is better. For, if they need a different cut point than a Holstein. So for the moment, we're just using the same cut points for Holsteins.
Okay, got a question here, and I noted in the chat box we had an attendee from Saudi Arabia and another one from Greece. So it's midnight there almost. So
Oh, thanks for joining us.
yeah. So along those lines, Saudi Arabia that triggered this. Remind me about this question. Question here, can you please comment about colostrum management under heat stress conditions besides heat abatement? Perhaps something different on nutrition, vaccine, or vaccine management?
So we've already talked about the importance of heat abatement, not just for the benefit of the transition cow, but the colostrum volume and quality, and the gestating fetus as well. So heat abatement's important. But other things, nutrition, I guess I'm just going to say, whatever your experienced nutritionists are recommending, using NRC guidelines for, good dry cow rations, far off and close up dry cow rations, just stick to those guidelines until we have data to say otherwise. We want to make sure there's adequate energy and adequate starch in the close-up ration. We want adequate metabolizable protein in that close-up ration. But we don't have studies to say that, no, the levels should be different than what current NRC guidelines suggest. So I'm for the moment, until we know better, know anything different, I'm just going to say stick to the NRC. And I don't know if guidelines are different in Saudi Arabia than they are in North America. I can't speak to that. As to the vaccine question, we've already talked a little bit about the timing of the vaccination and staying on label and making sure that you're, like as Scott said, at least 3 weeks out, and to make sure that there's sufficient time for her to respond, produce the antibodies, and then move them into the colostrum. I guess another vaccine consideration to do with heat stress is we don't want to pile multiple stressors onto cows at the same time, or one, we can overdo it, and we can if there's a lot of endotoxin in the vaccine, we can actually create problems. And if you vaccinate under heat stress with a vaccine with a high endotoxin load, or multiple vaccines with a high endotoxin load, we can actually do some damage there. Cows can abort, drops in dry matter intake, that kind of thing. So when we do vaccinate, just make sure, I think it's just common sense, that you don't pile on a whole lot of vaccines at the same time. You kind of spread them out. We don't want more than 2 gram negatives at the same time. And you do it at the coolest time of the day, not in, do it in the morning when things are still a little bit cooler and the cows are not stressed, as opposed to in the middle of the day when the heat stress is at its worst. Scott, is there anything else I'm missing there?
I don't think so. Those are all great points. I just think we can't underestimate what proper heat abatement can help do with not only the pregnant cow around the time of calving, but certainly her calf and the long-term effects there. The group out of Florida has done some tremendous research every year for the last decade or so, and just and heat stress is in many more places than we often realize. So
agreed.
Okay, let's see. We're getting through most of these. Some repeats. There was a question about feeding. I think it was pertaining to Jersey calves, feeding a first feeding of 4 liters and then coming back on a second with 3 liters. Is that problematic? I guess your comments there.
Okay. We did a study a few years back on this Jersey dairy that we work with in Minnesota, where we did feed 4 liters at one feeding. We didn't provide a second feeding. And they didn't explode, but they were definitely uncomfortable as we were running that final 4th liter in. We were using a tube feeder, obviously. They were definitely beginning to protest a little bit and kick a little bit and bawl a little bit more. So they were definitely uncomfortable. And when I measured the serum IgG levels in those calves in that study, they were through the roof. They were on average above 40 grams per liter. I've never seen anything so high in my life. It was insane. So we were saturating these little calves with IG, which is fine, except I think it was probably overkill. It wasn't necessary. And given the discomfort level, that we could appreciate, we backed it off, we used what we learned from that study and backed it down to 3 liters going forward. So I for a Jersey, typical 55-pound Jersey calf, I think, assuming your quality of colostrum is pretty decent, I think 3 liters is sufficient. And as the second feeding, that's fine. If you want to do a second feeding, great. But again, do it through either a nipple bottle or a bucket and not repeated tubings, please.
So 3 liters, first feeding in whatever manner works best for your situation, and then second feeding more as an ad lib, not a forced feed.
Sure, yeah. And like I said before, if they're still full 8 hours later, leave them alone, come back the next morning, they'll be ready.
Gotcha. Here's a good question. I have heard a recommendation that acidifying colostrum can kill bacteria like Salmonella. Is there evidence to support this claim?
There is evidence in not acidified colostrum, but acidified milk, that you need to drop the pH pretty low, like down to 3.8 to 4 in that range for acidified milk in order to kill Salmonella. And even then, some Salmonellas are tough. They're going to stick around for up to 24 to 48 hours before. So basically you have to acidify it and then let it stand for 24 to 48 hours to kill it. And you have to get the pH really low. The problem with getting the pH really low is a low pH will denature the IgG. So I do not think that we want to go down the road of acidifying colostrum just because of the IgG damage angle. Acidifying milk is one thing, acidifying colostrum, we run the risk of damaging the IgG. Also, if we get the pH low enough to kill Salmonella, it's also so low that it's going to be unpalatable to the calf. So if you're trying to bottle feed that calf, it's not going to want to drink it. So yeah, bottom line is I guess I would stay away from acidifying colostrum.
Okay. Question about what do you feel is the best way to store colostrum if you don't have bags? So for storing in the refrigerator or the freezer, I mean, you can use, anything that's clean. It could be a clean Ziploc bag. It could be a clean milk jug. As long as it's clean, it really doesn't matter. You want to give some thought to when you're going to want to thaw it or warm it up later again. The shape of the volume that let's say you're freezing it. If you freeze it in a 1-gallon milk jug, it's going to take a long time to thaw that big square, rectangle, whatever cube out. Whereas if you freeze it in smaller volumes, like 1 quart or 1 liter volumes, a smaller volume has a greater surface area exposed. It's going to thaw that much faster, or it's going to warm up that much faster. The perfect udder system, I showed a picture of the perfect udder bags somewhere along the way. They work really well in one that they're clean. They're single-use disposable. There's a picture. Single-use disposable bags. So they're very clean. And they've been designed, like the material that they're made of exchanges heat really nicely and cold. And it's engineered to be a flat bag, so it exposes more surface area so you can warm it or thaw frozen colostrum that much faster. I'm not trying to promote that system in any particular way. It's just an example of a smaller volume, greater surface area exposed, that'll thaw or warm more quickly. But whatever you use, just make sure it's clean. Okay. We have a question from Italy. Dr. Mary from Italy. How can we achieve high-level serum protein with pasteurized colostrum, which is lower in lower rich in Ig than fresh colostrum. Not sure
Okay.
exactly about the, but yeah,
Okay.
just a comment.
Right. So if you're pasteurizing colostrum, and I skipped a slide, so my apologies. If you're pasteurizing colostrum using the high temperatures that we use to pasteurize milk, then yeah, you're going to damage the IgG. You're going to nuke up to a third of the IgGs. Please do not pasteurize colostrum using the same high temperatures that we use for milk. Instead, we recommend heat treating colostrum at a lower temperature, longer time. And that's which slide, sorry. Trying to find my slides here. If we heat treat at 60 centigrade or 140 Fahrenheit for 60 minutes, and we're constantly agitating and we rapid heat, rapid cool, we will not see a loss of IgG. You won't. Very, very high quality. Like if it comes out of the cow at 125 grams per liter, yeah, you're going to get a little bit, but who cares? If you get a little bit of loss at that level, it doesn't matter. I skipped past this slide, but in our pasteurized colostrum study where we had over 500 calves per treatment group, and I showed you I showed you this slide with the health differences. One of the slides I skipped was we also tested the colostrum. And this middle histogram right here on the slide shows you the average the average colostrum IgG in the fresh colostrum in blue or the heat treated colostrum in maroon. There's a tiny, tiny little numeric difference, no statistical difference whatsoever. So if you properly heat treat it at the correct time and temperature and all the rest of it, you should not be seeing denaturation of IgG. And in fact, you should be seeing better IgG levels in the calf serum, and that's in this histogram at the bottom. The two groups of calves were fed the same quality, quantity, quickness, and yet the calves fed the heat-treated colostrum ended up with higher levels of IgG in their blood, 18 grams per liter, than the calves fed the same colostrum, but as fresh colostrum, 15.5. So they were fed heat-treated colostrum. We preserved the IgG equally well, and we actually got higher IgG levels in the calf blood. Why? Because we're removing bacteria. And as I remember I talked to you before about the importance of bacteria in blocking or interfering with Ig absorption. Well, if we can reduce the numbers of bacteria in the colostrum, then there's less bacterial interference with absorption. We get higher levels in the blood. So I would argue if you're pasteurizing colostrum and you're seeing worse levels, then you're not doing it correctly. Please drop me an email and maybe we can sort out what it is that you're doing that's not working.
All right, thanks, Sandra. I've got a quick question on vaccination on Scour Boss. And it seems like this one pertains maybe a little bit more to beef cattle, but I think it's important to consider this in our dairy cattle as well. This is Scour Boss 9 is ideal vaccine. However, in cold weather climates, it's difficult to get compliance after fall processing to do much other than feed pregnant cattle well. What is the duration of immunity after Scour Boss 9 is administered, and how important is a timely annual booster? Does this differ with older cows and younger heifers? So I'll take us back to the label. So Scour Boss is labeled for use in heifers and in lactating cows. So that first year in your heifers, we recommend a dose of Scour Boss 9 somewhere between 16 and 8 weeks pre-calving, and then followed by a booster dose of Scour Boss 4 approximately 4 weeks prior to calving. And that's really, really important to get those 2 doses that first year. We do have a single dose claim on the E. coli and the Clostridium portions of the vaccine, but those viral fractions need to be boosted. After that, a typical annual revaccination is what is recommended. And I'm not aware of any duration of immunity work that's been done with any of the Scour's vaccines. But we certainly do have some data that shows a really strong anamnestic response at that annual revaccination. So I think that's If you can get it in annually after they've been properly immunized that first time, you should be in pretty good shape. Sandra, I got a question here from Denmark. It says your data shows really good quality colostrum from heifers. It is a totally different story here in Denmark. How were those heifers fed and managed? Do you use oxytocin when milking heifers 1 to 2 hours after calving? I guess maybe a comment on colostrum quality in heifers and best practices there.
Okay, well, I didn't show any data today on heifers, but I can talk about other studies that have evaluated heifer colostrum qualities compared to older cows. On average, it is a little bit poorer, but that does not mean to say that every heifer fails, that it's less than 50 grams per liter on heifers. I can't remember the reference right now, but it's in my review chapter we just wrote last year. But you know, let's say the heifer average colostrum quality in one study, I'm blanking on the reference right now, was roughly 65 grams per liter. That was the average heifer quality. And in the older cows, it would be, you know, roughly 70 grams per liter. So yes, it's higher in the cows, but not, that doesn't mean to say that it's horrible with the heifers either. In terms of producing high quality colostrum out of heifers, and we're, you know, I think we're seeing it here in North American herds for the most part. It's the same stuff that we've already talked about. We want to make sure that, so they don't get a dry period per se because they've never lactated, but we want to make sure that they get moved into the close-up ration with heifers, I think 4 or 5 weeks ahead of the target calving date to give them more time to, you know, adapt the rumens and so forth. Acclimatize, get used to the feeding system, you know, headlocks, free stalls, whatever. Get them into the close-up group 4 or 5 weeks sooner. Don't overcrowd. Don't, you know, provide the heat abatement, provide the vaccines. We've talked about that already. There's a little bit of work on behavior, and ideally we'd like to not mix the heifers with older cows, because especially in crowded conditions, the older cows will outcompete the heifer for access to resources, including bunk space and feed access. So I think there are a number of things we can do for heifers to make sure that they have sufficient time in the close-up pen, to reduce stressors, to promote dry matter intake. I think it's all the same stuff that we recommend for her anyway, and that's going to feed back and help the colostrum quality as well. Scott, do you have other ideas? Anything I'm missing?
No, I think just what the best practices are for overall heifer management and success are going to result in a better prepared heifer to produce colostrum. So,
yeah,
no, I agree wholeheartedly there. I believe, I don't see any more new questions. I believe we got everyone's question addressed. If we did not, as Sandra mentioned, feel free to reach out to her offline sometime after the conclusion here. But I think we've more than benefited from the extra time. Thank you very much, Sandra, for the material, some wonderful recapping of things we might have heard before, and certainly some great new information for us to be considering and using as well.
My pleasure. Thank you.
Absolutely. Thank you both again, Scott, Sandra, Boss, and Alenko for sponsoring today. We really appreciate your time. We appreciate 212 folks hanging with us. Jody Sattler, my colleague, said we may have set a webinar record here, both for participation and length, but obviously it's a hot topic, and we really appreciate you taking the time and presenting that to our members and guests of the Dairy Calf and Heifer Association. I just want to remind everybody that we do have our virtual conference next week. It is a reduced rate registration, and we have a lot of the speakers that we're going to be presenting in person, including Jason Lombard with the USDA. So we hope you'll head over to our website, calfandheifer.org, and check out that rundown for our virtual conference next week. Anyway, that is it. A webinar recording will be made available on our DCHA website by April 5th. And this concludes today's webinar. Thank you all so much.